The COVID-19 pandemic continues to rage across borders, with the number of infections and deaths yet again on the rise. The fast-spreading new variants are raising concern that inoculation efforts are being hindered, as well as questions as to how effective vaccines are, given the report of breakthrough infections. And amid these concerns, we connect today with Dr. RUBIN, Editor-in-Chief of the New England Journal of Medicine and Adjunct Professor of Immunology and Infectious Diseases at the Harvard T.H. Chan School of Public Health. Very warm welcome to you, Dr. RUBIN. Thank you so much for joining us today. How are you today?
I'm good. Thank you for having me.
Well, it's an honor to have you on our show, and well, we've got quite a lot of questions about the new Delta variant and all these things we're hearing about these breakthrough infections. And well, first of all, you said that vaccines are not 100% foolproof, and these days we keep hearing more and more about these vaccine breakthrough infections, which the CDC defines as having traces of the coronavirus left in your respiratory system 14 days after being fully vaccinated. So why is it that a vaccinated person can be infected again, and how common are these severe breakthrough infections?
Well, I think there are two factors that go into this. As you said, the vaccines aren't perfect. They're awfully good, although they vary with different vaccine types. They're awfully good, and they prevent maybe 90% or so in the best possible circumstances of infections caused by the original strain of virus, the one that's similar to the one from China. But the virus has changed, and the vaccines are somewhat less effective against these new variants. You mentioned the Delta variant, and as we see new variants, we see some loss of efficacy for the vaccine. I'd add that we don't really understand it yet, but a lot of people were vaccinated a long time ago, and it's possible that immunity wanes over time.
And well, of course, if although such cases of breakthrough infections might be rare, over 1,000 people still have died from breakthrough infections becoming serious in the United States. So, well, who is rather susceptible to suffering a severe breakthrough infection, and what should be done to avoid it?
It's probably the same group of people who were most susceptible to getting severe infections before the vaccine was around. Those are people who are elderly and people who have other medical conditions, particularly those who have a compromised immune system. One of the problems with a compromised immunity is the vaccine doesn't work as well, because the whole point of the vaccine is to stimulate immunity. And if you can't respond to the vaccine, then you don't get very good protection. So people who are in those groups, I think that they need to continue to take precautions. Here in the US, we had until today the recommendation that masking wasn't very important for vaccinated people. But for those who are at highest risk, I think that masks, social distancing, all the usual measures that we were taking before probably remain important despite vaccination.
Right, definitely better to be safe than sorry. And well, there's been quite a lot of questions about the effectiveness of vaccines. And well, a UK study published this week in your journal, the New England Journal of Medicine, it found that the Pfizer vaccine is 88% effective in preventing symptomatic COVID, but that's more than twice the rate found in Israeli data. So what is the reason behind the discrepancy between these studies, and how should we really understand the numbers?
Well, this is a bit of a guess, because the Israelis have not, to my knowledge, published the underlying data supporting their findings. We do know that the vaccine was highly effective in Israel the last time we saw published data. And what we've heard, and what you and I have both heard, is that those numbers have declined substantially. So a couple of things could be going on. One is time. Maybe the vaccine is working less well over time. And the other is the introduction of new variants, particularly in Israel right now. That would be Delta. The UK data that you were citing, that was done at an earlier time point. So people had been recently vaccinated, and at least the Delta strain wasn't around. The overwhelming strain in the UK at the time was something called Alpha. Nevertheless, it is a bit surprising, because up until now, the data we've seen from earlier studies suggested that the most effective vaccines were also pretty effective against Delta. So I think we need to see more data, but it's clear that a lot more people are getting infected despite vaccination right now.
So the new Israeli data, it's generated quite a lot of debate about how soon the effectiveness of vaccines might wear off and whether there's a need for an extra shot. So what really is the need for getting a third booster shot, and what would be the cost of giving or not giving a booster shot to the population?
That's a great question. Right now, and I want to be careful because one of the problems during this whole epidemic is that we were putting in place things before we tested them. I'd be much more reassured if we knew that a third booster was both effective against disease, and it does look like it will be, and that it was safe in larger populations, and we don't know that so much. So I think there are a couple of costs to receiving a third dose. One is the potential that there might be more side effects. We can't count on that by any means, but I think we want to know so that we can understand the risks involved. And the second thing is the availability of vaccine. I've got to say that it's kind of difficult to see wealthy countries like the US giving everyone third doses of vaccines when most of the world can't get a first dose. And not only is that create a humanitarian crisis, but it doesn't help anybody else because the new variants are going to arise in places where there isn't much vaccination. So it's in everyone in the world's interest that the entire world get vaccinated.
Well, actually, people in countries that have mostly vaccinated a lot of their population, they're now wondering whether they should get an extra Pfizer or Moderna shot, although they've been vaccinated with the Johnson & Johnson or AstraZeneca. Do mRNA vaccines actually provide more protection? And do you think this would be necessary, getting that extra mRNA shot?
It does appear that the mRNA vaccines work better than the two other vaccines that you mentioned, which are based on a virus, an adenovirus, and clearly better than the inactivated vaccines like the Chinese vaccines that are in use in many places. That being said, we, again, don't know too much about boosting. It does seem likely that the mRNA vaccines will be the best boosters for most people as long as they're safe at a third dose. And right now we have a very small number of people who've gotten a third dose, so it's hard to assess.
Well, the Delta variant now is making the headlines of many newspapers around the world. And well, the Delta variant is surging again but it's surging in Israel, even though more than half the population have been vaccinated so far. Does this mean that the vaccines are not as effective as we might have hoped they would be? And also, how is this new variant affecting herd immunity goals and vaccination plans for governments?
It does appear that more people who are vaccinated are getting the Delta variant. We don't have great numbers for that, but of course we've heard from Israel that there's an increase in infection, and that has been attributed to Delta. Around here in the US, we're seeing outbreaks, small outbreaks, but outbreaks in vaccinated people, and those are coming from Delta. Right at my own hospital, at the Brigham and Women's Hospital, there are now several staff members who are infected, who were vaccinated early on. So Delta does seem to be a problem. Remember, it's not our last variant. There are more variants that are out there, and there are more variants that are going to appear. That's what evolution does. So I wouldn't concentrate too much on Delta, but the general idea that there are going to be viruses appearing that do a better job of infecting vaccinated individuals, I think is one that we have to always keep in mind when we're thinking through the strategies.
And we're hearing quite a lot about the Lambda virus as well. How dangerous would you say that variant is, and is it something that we should keep an eye out for?
I think we have to keep an eye out for sure. There are at least a couple of other variants, including Lambda, that are out there whose significance we don't really understand yet. It will become clear, just as it did with Delta, just as it did with Alpha, and just as it did with Beta, how important these are. In each case, what happened was a new viral variant basically took over, swept out the old variant and became the dominant virus. So we'll get an idea early on if that's happening as we start to survey populations.
But of course, governments all over the world, they're really itching to reopen their economies. And we can see this in the UK and England, where they've removed a lot of the restrictions that were in place to keep the virus under control. But well, even though most of the population have been vaccinated, what are the precautions that must be kept in place as societies fully reopen?
So there's always a trade-off. It's not so simple to say, okay, today we can open, or tomorrow we can open, or we can only open partially. Whenever we decide to open up completely, we're going to get more spread. And that, of course, has happened already in places like Israel, in places like the US, and in places like the UK. We're starting to see more transmission. We could do something that's a little more partial. And the US CDC today recommended that people wear masks under certain circumstances, even if they're vaccinated. So there are in-between measures, something between complete lockdown and being wide open and allowing anything to go on. What is the right metric at any given time, I think remains a question.
And it looks like a lot of people are getting summer colds as well, and that's really sort of confusing the whole process of really, being cautious about the virus as well. It's rather confusing whether you have the summer cold or whether you have the virus. And well, what should we really do at this point to really protect ourselves against both sorts of viruses?
Well, I don't want to say that people should always wear masks. But remember that last year, the flu, which travels around the world during the fall and winter, basically disappeared. And it disappeared because people were wearing masks. Masks are very good protection against all respiratory infections. So to the extent that it's important to wear a mask to protect against COVID-19 infection, I think people will benefit in all sorts of respiratory infections.
And do you think this virus is actually going to go away completely, or weaken at least, or do you think it's going to keep evolving, and even especially if vaccinations don't speed up?
I'm an optimist. I think that we are going to be able to make enough vaccine for the world, and I think that's going to happen over the course of the rest of this year, I hope, and into the beginning of next year. And I think that we're going to be able to convince more people to get vaccinated among those who remain concerned about it. But I don't know that it's going to be perfect. The more we protect people, the more people who are vaccinated, the more people who are following other sorts of measures, the fewer variants will appear. But as long as there are circulating virus, there will continue to be evolution of that virus and the appearance of new variants. And with each new variant, there's the risk that it will be more infectious or more able to infect people who had been previously vaccinated or previously infected. So I think things are going to get better. I'm not convinced we're going to wipe this virus off the face of the earth, as we've done successfully with its predecessor, the original SARS coronavirus. I was hoping that we could get there, but it's going to be a ways to be able to do that.
Well, hopefully there will be progress in the vaccinations all over the world very quickly. And well, this is where we must leave the interview today. That was Dr. Eric RUBIN, Editor-in-Chief of the New England Journal of Medicine and Adjunct Professor of Immunology and Infectious Diseases at the Harvard T.H. Chan School of Public Health. Thank you so much for your time.
Thank you.
And to our viewers, as always, thank you very much for watching.